Hello, my name is Selveta from Santen from Rotterdam, the Netherlands, and my poster is about body composition and bone mineral density in patients with craniopharyngioma. Patients with craniopharyngioma suffer from hypothalamic damage and pituitary deficiencies very often, but still there is little known about changes in body composition and bone mineral density. So therefore, we included patients from Holland and Sweden who had a craniopharyngioma and who had DEXA data available at the age of 18 years and older. We included 112 patients, of which 44% had a childhood onset disease, and the median age at first presentation was 25 years, and the median time between DEXA scans, so the very first and the last DEXA scan, was 10.8 years. 14% of the patients had used bone mineral density increasing medication, and almost all were treated with surgery for their craniopharyngioma, and 55% had used radiotherapy. Almost all patients had some form of pituitary deficiencies, as you would expect in this population. We saw a significant increase over time in body mass index, fat mass index, fat-free mass index, but not in fat percentage. And if you looked at the standardized deviation scores, there was only a significant increase in fat-free mass standardized deviation score. All Z-scores improved over time. And if you looked at variables associated with a change in Z-score, these were the variables associated with the univariable analysis, although corrected for baseline Z-score and age at first DEXA scan. What is very special is that bone mineral density increasing medication was actually associated with a decrease in Z-score. This is probably not a causal relationship, and it's just due to a certain selection bias that the patients who needed the bone mineral density increasing medication the most actually showed a decline in bone density. Hydrocortisone equivalent dose was also associated with a decrease. So in conclusion, patients with a craniopharyngioma remain stable in BMI SDS, fat percentage SDS, and FMI SDS, while the increase in fat-free mass index SDS and bone mineral density Z-scores. Hydrocortisone dose, radiotherapy, and medication to improve BMD were associated with a decline in Z-score, while growth hormone replacement therapy was associated with an increase in bone mineral density Z-score. Thank you very much for listening.